Good morning, Lehigh County, and welcome to our every Friday morning webcast. This morning, I have two very well represented gentlemen sitting next to me. No, they're not here to come take me away. They're here because we've been working with the Allentown Police Department for approximately almost a year and a half now on a project that we're very, very proud of, that we're looking to expand now with the cooperation of Allentown and hopefully expand it throughout the entire county of Lehigh. But the experts on this project are with me here to tell you a little bit about it. So, the acting police chief of the city of Allentown, if you would please, Mr. Roca, explain a little bit about what we're doing in this program.
Absolutely. Hello, everybody. My name is Charles Roca. I'm the interim police chief in the city of Allentown. It's my pleasure to be here with you this morning. One of the things that I want to tell you about is about the history of the CIS program, and that is the Community Intervention Specialist. This program actually began in 2017 in partnership with Pinebrook Family Answers, and the program started out as one worker who was identified as a mental health liaison. And during the course in time, when I became captain in 2018, I was able to look at the program and take ownership of it along with our partners here, because we are here to serve the community. And we looked at that title of mental health liaison, and it became very clear that our community intervention specialist does a lot more than just speak or refer resources for individuals that are mental health consumers in the community. They also are connecting them with different resources such as housing, food, shelter, those types of things. And in that vein, we changed the title to Community Intervention Specialist. Our officers on the department work very closely with our Community Intervention Specialist to be able to connect the people out there in the community with resources. At times as police officers, we will go to different calls for service, and there may be an issue that comes up for that community member, such as housing, such as mental health concerns, or other issues of that nature. And our officers will provide a referral to our community intervention specialist, who will then connect that person with resources. They'll reach out to county agencies, reach out to different organizations in the community to be able to make that connection. I will tell you a story of something that I personally experienced with our community intervention specialist. I was out at a block party at 8th and Gordon. This was, of course, pre-pandemic. Sad that I have to talk like that, but it is. In the pre-pandemic time, and there was actually one of our officers giving a canine demonstration, and this young lady came up to me with her son and advised me that she was being kicked out of a shelter that she was recently at, explained that she had some issues and her son as well, and I was able to connect her with our community intervention specialist, and this person was able to get help. And now this person is able to work, is able to get their own place to live, and is now doing very well. And that's just one small example of how it is. And you might be thinking, well, how does this affect the police department? How does it work? Well, it's quite simple. Our officers will go out on different calls for service. They'll see a need for the community. It might not rise to the level of a police intervention, but we are able to connect people with resources. And I think it's even more telling during this period of the pandemic that we're going through, where different people are dealing with different things in their lives. And in this instance, our police officers are able to recognize those factors, connect the people with assistance through our community intervention specialists. It's kind of the clearinghouse so that they're able to connect with Lehigh County Mental Health, Lehigh County Crisis, other organizations that I've mentioned. Now, where are we going in the future? With the assistance from the county, with our Chief Law Enforcement Officer, Jim Martin, our district attorney, we are able to collaborate and make this operation grow, where we are going to have a CIS worker for each of our platoons within our police department. And in this vein, the police officer will be the primary responder and still increase the amount of resource referrals that we can come, so we can actually reach a larger percentage of people in the city of Allentown. I do know that the County of Lehigh does have a county CIS worker, and that individual does work with the other police departments within Lehigh County. And in this vein, also, we're able to make those good connections. It's about building relationships, connecting with our community, and ensuring that we, as a police department, are recognizing the needs of our community. And it's very straightforward because in having this relationship, the officers on the platoons also develop that relationship with our CIS worker, and they're able to share that information. If there needs to be a follow-up, for instance, and an individual needs to communicate with our CIS worker, our officer will accompany the CIS worker. That interaction will happen, and they'll be able to further connect with that individual, provide additional resources and details. And I know that our community intervention specialists are very much enjoy this type of work, enjoy making those connections with people. So that's what it's all about. The city of Allentown is a great place to live, and by that, Lehigh County as well. We're in this together, and we're gonna work our systems so that they're together. And I just want to take a moment to tell Mr. Armstrong thank you. I want to say thank you to Mr. Martin, our district attorney here in Lehigh County. Excellent partnerships to be had. We're going to grow this program, we're going to develop it, and we're going to make sure that we are providing the best service that we can to our citizens in Allentown and the citizens in Lehigh County.
Chief, as I've been saying, as county executive, I'd like to lead with the idea of possibilities. And when this program got started, we were looking at the possibilities. And because it is working, and because we're working with Cedar Crest College to keep the data on this program, we're looking to expand this program and hopefully take it out to even more municipalities as we expand. We were informed this week that Lehigh County is one of the top counties in the state at diverting people from the legal system or getting into our jails by these kinds of programs. So it's cooperation, collaboration, as you said, with our district attorney, with our police departments, with our human service departments. These are the people all working together to make this program work. So for people in Lehigh County, we want you to know we are working together, we are getting things done, and I appreciate you taking the time to come out here this morning to help us get the word out, to let people know, Lehigh County, what's going on. So please, stay safe, stay healthy. Remember, we still didn't get everybody for that shot. We want to do that. Take care.